Okay, so we'll cover the next part. Uh, so we'll continue with the next part of diarrhea. That is now what is the approach to a child with diarrhea? What will be the approach to a child with the diarrhea? Now this is very important. So we'll cover some of the portions in this class. See, whenever a patient comes to you, what should be your approach with the diarrhea? First, identify whether this diarrhea is acute diarrhea and chronic diarrhea. We know that how you will identify. In case of acute diarrhea, sudden onset, more electrolyte disturbance, more sickness of the baby, everything will be there. Chronic diarrhea, yes, gradually it's progressive diarrheas. Chronic history will be there, and electrolyte imbalance is much, not much. Okay. Next thing is you identify whether this diarrhea is functional diarrhea or organic diarrhea. You have to identify whether it's functional or organic. So next you have to identify whether this diarrhea is small bowel diarrhea or large bowel diarrhea. Okay. So then you look into the volume and content of the stool. What is the volume and as well as content of the stool? Content in the sense whether it's blood mixed, whether it's bile mixed, whether it is mucus mixed, whether it is fatty stool, etc. Now then you look into the associated symptoms like malabsorption. Only diarrhea is there, also you find the malabsorption syndrome, malabsorption of the carbohydrate, malabsorption of the fat, malabsorption of the proteins. You know that carbohydrate means carbohydrate is a glucose source. Glucose is very important for all the bodily actions. Okay, it's the richest source of ATP. So अगर ग्लूकोज नहीं मिल रहा है, कार्बोहाइड्रेट का माल एब्जॉर्प्शन डेफिनेटली जनरलाइज वीकनेस तो आएगा उसको. ओके, देन एनल एक्सकोरिएशन, ये सब तो है ही है. Fat means I told that body weight will decrease and also fat soluble vitamin problems आएगा. And protein means protein is important for body building, therefore muscle mass will come down. So this is we have to identify associated malabsorption syndrome. Next, you see whether this diarrhea is painful or painless. If you have got painful diarrheas, infective causes or inflammatory causes, infective inflammatory or non-inflammatory causes, infective causes, non-infective inflammatory causes, anything may be there, autoimmune, etc. Or sometimes it may be painless diarrheas, osmotic diarrheas, etc. May be painless. Now again you have to see whether this is associated with the bleeding. If the bleeding is associated, then it comes under another category of dysentery, diarrhea and dysentery. So then the approach will going to differ. Then again you have to see whether it's inflammatory or non-inflammatory. Inflammatory may be associated with the fever, non-inflammatory may not be associated with the fever and other symptoms. So actually this particular slide gives an overall idea. Whenever the patient comes to you, these are the things that you have to observe, seven points. Identify whether it's acute or chronic, identify it's functional or organic, then look at small bowel or large bowel, then look at the volume and the content, then look at the associated symptoms, look at the malabsorption. If you're able to identify, try to identify it. Look at painful or painless, then bleeding, yes or no, then inflammatory, yes or no. That's all. If you follow this particular pattern, protocol, then you will not miss the diagnosis. Otherwise, most of the time there is every chance that you miss the diagnosis and go for unwanted medication and unwanted investigations. Unwanted medication and as well as unwanted investigation. Okay, and ultimately patient has to suffer. Now this is how to differentiate between the acute and as well as chronic. First one, acute means it is within 7 days, chronic means more than 14 days. In case of acute, we know that the onset is always sudden. In case of chronic, onset is always gradual. In acute, electrolyte loss is more. In chronic, electrolyte loss is very less or very slow. In case of acute, the dehydration, if you see, dehydration is very much marked, and in the chronic, dehydration is not much marked. Of course, dehydration will be there in chronic, but it is invisible. And this is quite more dangerous actually. Okay. So this is how you have to identify whether it's acute or chronic diarrhea. Now you go for another important thing, identify whether it's a functional or organic. Okay. Functional means, in case of function, duration is functional means without any obvious cause, maybe psychological, etc. So duration is long. Organic means duration is short. Okay, if it is gastroenteritis, you will have a particular duration and symptoms are go on worsening. Whereas in functional, it will persist for so many times, so many days, but still child is not having much problem. Then constitutional symptoms, we know that in case of functional, constitutional symptoms are less, like body weight loss, loss of appetite, all these things are less. Whereas in organic, these things are more marked. And in case of functional, weight loss is not there. In organic, weight loss will be there. Then appearance, in case of functional, the child looks very normal. Organic means child is either sick or depressed. Nocturnal diarrhea is not there in functional. And organic diarrhea, there will be nocturnal diarrhea also. Nighttime also baby will have the problem. And gastrocolic reflex, functional, whereas gastrocolic reflex is not, that means in organic it is not seen. Anxiety symptoms will be there in case of functional, it is not seen in organic diarrhea. So this is how we have to differentiate between functional and organic. So anyway, we will going to stop today here. In the next class, we will continue with the next topic of the same. Thank you very much. So we will going to stop now.